Roadmap for School Mental Health System Improvement breaks down 5 steps for improving the quality of a school's current mental health supports. Comprehensive school mental health systems rely on a shared commitment across school and district staff, community partners, out-of-school time providers, and most importantly, our students and families. Each group plays a unique role in the process of improving school mental health systems, all with different levels of commitment and types of collaboration. The steps to building commitment include building support from key shareholders, assembling a representative team or coalition, increasing mental health literacy in the school community, and establishing and communicating a shared mission and vision.
Build support from shareholders.
In the Merrill community, we're not very resource rich, but we're very people rich. And once you start to build those relationships, they're going to want to show up for you, and they're going to want to make sure that they're a part of the exciting movement and change. If people feel good when they can do good for others.
The good fortune is that our community, our school board, our teachers, our, all layers of people that are living within Merrill are really open and embracing and talking about mental health. So they are very invested in it, and they all see the value of coming together.
We have human beings with big hearts that care, and so if we can bring all those people there and, just remind each other that we all have the same goals and the same things in mind, that's where we make the biggest success.
Assemble a representative team or coalition.
A multidisciplinary team is where we bring in a lot of people from a lot of different areas, community resources such as tribal social services or Burnett County social services or police liaison officers and some of the community resources, Journeys Mental Health. So we bring in partners from the outside.
How can we work as a community to wrap our arms around those kids and be able to really support them and their needs? And that is why it's so important to have that community-based approach instead of operating in silos.
Increase mental health literacy in the school community.
The 4 main pillars of mental health literacy are having an accurate understanding of mental health and the social and environmental factors that impact well-being, having an ability to promote wellness in yourself and others, having the skills to have supportive conversations with people who may be struggling, and having the attitudes and beliefs that reduce stigma towards mental health. With increased mental health literacy, we learn to take better care of ourselves, our students and staff, and our communities.
Establish and communicate a shared mission and vision.
Community and school wellness really is about making sure that our students and our staff are all working together towards similar goals and similar visions. So if our staff are supported in the classroom in the same way that we're supporting our students, the staff may feel more able to help support the students.
Hiring the right people and setting up the expectation that they're here to do the work that is important to us and that meets our mission and vision and what our core values are is the first step. Then identifying those evidence-based practices and trainings that they need to have some expertise in and embedding that throughout the school year.
Throughout the commitment step, teams will maintain a strengths-based approach, consider who's invited to the table, so whose voices are represented, and they'll work towards a shared vision of well-being that leads to more equitable health and educational outcomes for our students. Regardless of their role, everyone in the school community can make a shared commitment to increasing mental health literacy, decreasing mental health stigma, and working to change aspects of school or other systems that create inequities and act as barriers to well-being. You don't need to be a mental health professional to have an important role in school mental health.